So we were talking last week mainly about the blood clotting. Let's just go straight into that. I'm not going to use too many actual words and stuff. I just want to, this slide is making the point. I've been talking about a paradigm shift for about the last 10 years. In fact, I even started my PhD doctorate, and all over the doctorate, it talks about a paradigm shift. Of course, I'm halfway through and not finished, but of course the paradigm shifted. So it's a little bit of a joke, but I think paradigms don't stop shifting. So, and we're not all there. So it's the beginning, the bottom of the curve coming up. So quantum medicine is a paradigm shift. And this is just a little bit about natural medicine, quantum medicine, and the healthcare is in crisis. And, you know, the importance of identifying the root cause of disease. So many times people come to me, oh my gosh, on one medicine after another, with the weirdest explanations you could ever think about. The one lady was told that her pelvis had contracted and it was stuck and she needed an operation. Well, within a couple of days and a couple of what's become our routine methodology in terms of resetting people, detoxing and resetting, there was no sign of a pelvis that had contracted. So lots of people are being told a lot of stuff. And anyway, the root cause is very important, validating the risk factors and then realignment, and then being able to measure your realignment. So let's just see if everybody's happy. Yeah. So the point about this, last week I was speaking about the blood clotting and sticky blood, because I was really seeing a lot in normal people that were coming to me for different things, different ailments, different diseases, not even anything to do with infections. And I was finding most of these people living in the cities, right? There was sticky blood, low oxygen levels, low amounts of water being drunk, so poor hydration, high acidity, high inflammation, immobility, sitting a lot. Many people who'd had recent surgery. There's also blood clotting aspects, obesity, large people. You will find tendency definitely for the blood to clot, and it's not the red blood cells are very sticky. People who battle with fat metabolism, calcification, and plaque forming, you'll find sticky blood there, you'll find clots. And especially here, so the one is fat metabolism, the other one is protein metabolism. And when you don't get proteins developing properly, and I see actually Lee, Dr. Reggie Reddy is in the audience, and we can maybe call on him a little bit later, but on some of our joint presentations, we've talked about the importance of breathing. And the breath and breathing and oxygen are the beginning and the end of everything. And we find that digestion slows down when the breath isn't maximized, when we're not breathing from the lungs. And so it's absolutely critical. Oxygen is critical for digestion. So sticky blood will be inappropriate fat metabolism, and likewise protein metabolism and calcium metabolism too. So those are very important, and they all play a role in sticky blood. And it accounts for probably 90% of the people right now. Radiation is having a massive effect on blood clots. Massive cause of blood clots. And where I live, there's a white radiation tower basically at every intersection. And following on from that is a camera with about a pole with cameras at about 8 cameras. So I don't know what, I mean, I live in a cul-de-sac and there are 8 cameras at the end of my road. So it's really crazy, the closing in of radiation. And it's increasing the clots. So with pregnancy, if there's high estrogen levels, tendency for clotting. And if you already got a sticky blood, it's even accentuated even more. Infections, circulating immune complexes, you know, Lyme's diseases, dengue fever, hemorrhagic, Korean hemorrhagic fever, which causes bleeding and mess of the blood as well. They will all cause the blood to slow down and the red blood cells to get sticky. And in fact, many of these organisms actually grow inside the red blood cell. And then they split off, especially the spirochetes. They come out the mycoplasma too. They grow inside the red blood cell. So we see so many damaged and deformed red blood cells, and on top of that, we see also damaged membranes around the red blood cells after exposure to, well, swab tests and the disease, and also, you know, the injection. And that's very worrying. Smoking will definitely every single time cause thick blood. Birth control pills, these are medicines, hormone replacement, breast cancer medicines, all cause sticky blood. And certain cancers as well are going to also cause thick blood, and blood-related cancers will do it too. So let's see here. This was a study of the one client presented with these. I've put these slides on our group, but just to talk about it properly, these are the clots that I saw. The white parts are parasites, pathogens. That one there would be an acid crystal. So lots of these parasites all over, and this is the dark field. And then in the light field, I saw all of these, and these clumps of toxins. Call them what you want. I don't know if you think there's a direct name for them, but this man was riddled with them. And doctors are now also, other doctors with microscopes are also talking about this. So very terrible blood to start with. This man fell down for no cause, no reason whatsoever. He fell down post, and my view is that the blood progressively gets worse. It's not actually, the body's not able to clear it because the cells are dividing with the wrong genetic code. This was still post-injection and pre our oxygen drips. So masses of infection, blood clotting, sticking together, graphene, and of course, definitely leaky gut. So there's always a leaky gut. So that's why there's lots of nausea, and that's why there's a lot of brain involvement as well, because what happens in the gut happens in the brain. So the contents of the gut go into the blood, further making the blood thick. And then we put this client on an intravenous oxygen drip. So that will be at our IV drip clinic for chronic disease and infection, where we're preventing people from having to go to hospital, because we literally let the oxygen straight in, directly into the vein, oxygen water. And then we start seeing this happening because we track it all on under the microscope, before, during, and after. It's too extraordinary because you actually see the clot starting to break apart. You see the red blood cells, sometimes chunks fall off, and then you see the little red blood cells also separating. And we know that that's happening in the rest of the body. Very, very, very exciting to be at this point, to be able to see it. So here's a red blood cell. I mean, here's a clot that's starting, same man, same clot, starting to break up. You can see. It's too amazing when you see the work of oxygen. It's just incredible. So this is just a picture, not mine, of the fibrin network. When we talk about a protein fibrin network, so this is what happens when the protein doesn't digest properly. All right, it floats around in the blood. It accumulates in the kidneys. Generally, the liver's not metabolizing the protein properly as well. And there's also generally not enough protein enzyme being secreted, and that has a whole stress aspect to it, and also a hypothalamus pineal pituitary gland aspect to it. So very exciting to see that. And then here is the blood. Blood thinning post our O2 IV drip. Unbelievable, remarkable. The only comment here really is the patient needs some more iron. And there's a lovely, huge, big white blood cell, all active, moving, cleaning. So we came in, we swooped in, and we helped this man clear. I cleared everything. There's none of those little marbly, green, stony toxins. There's none of the black ones. There's virtually, I mean, he's not completely clean, but there's virtually very little parasites. And I think this is spellbinding to me, and earth-shattering and all the rest of it, because look what we achieved with the direct oxygen water. And here's an example of the clinic in Johannesburg. And I'm going to show you some more pictures, more fun pictures now. There's our clinic with our diagnostic scans and so on. And it seems the oxygen water makes you a little bit chilly. So that's why there's lots of blankets there, because people get a little bit cold. But honestly, we've really got it completely worked out now, and we know exactly what we're doing. We've got a lot of very, very serious chronic conditions. And I want to tell you, the more chronic conditions I get, the more I get. So we're in a fortunate position to be really at the leading edge, cutting edge frontier, pioneers in health. And in fact, I have registered nurses that come and work, and they are absolutely spellbound as well, because they are not used to seeing recovery. They're used to running around the wards, running around the ICU, looking for the medicines, looking for the antibiotics, stressing, sweating, patients not recovering. And here we have a beautiful organic environment where, well, it's full of indigenous gardens and birds and things that's relaxed. It's got a lovely energy, and people come in and they are relaxed and warmly welcomed. We do the scans, we do the live blood, put it onto the slide, put it under the microscope, come back, give feedback. And they're consuming water and lemon water, smoothies if they get hungry. Some people have even had jungle oats and with goji berries in and things like that. Probably some of you in the audience. And so we sustain the patient, because some of the drips are 3-4 hours. It depends on your capacity and threshold for the oxygen. And we're just moving forward. We're scaling it, because I suppose we have what we need right now. And so people would come in a chronic state, either on the verge of a nervous breakdown, severe Lyme's disease, painful cancer areas, autoimmune skin diseases, all sorts of things. And within hours, you see the life force, you see it infiltrating their face. And they leave with just the most beautiful faces, wonderful, calm disposition, and most times they've slept as well. So the parasympathetic nervous system has come in and really enabled healing. And we're introducing auricular acupuncture at the same time now, which will also cause a shift in the past negative thoughts. Very important for the degenerative cancer patients, because any of them, even the autoimmune skin disease, we need to shed the old negative thoughts and surrender to them. They're no longer serving us, and enable people to shift into the new paradigm. And it's not always verbal. So non-verbal way with the acupuncture, I'm finding, is just working even better. We're getting even better, even quicker, even remarkable shifts like this. So obviously I also have a time crystal in the rooms, and I'm now wearing one too. So we're getting also the benefit of the very high frequency scalar wave within the room as well. So when we look at it all together and very holistically, I'm very pleased to say we've got a beautiful, really beautiful winning formula here. And I'm going to go into this a little bit more in depth just now. But this is also, I think it's on the website under center bookings, and there are all sorts of drips, short, quicker drips. There's a short, quick oxygen drip, and we've also got our nutrients in a drip, the vitamin C's, the glutathiones, minerals, vitamins, immunity boosts, energy boosts, and we've got special prices. But this was just left from last week, And I really am finding safe, fast, reliable, affordable, and effective treatments. Now, many people have the best intentions of the world, and they buy their products, and they take the product for 5 days and it sits there. And they know they should take it and they know they should finish it. Some people, those kind of people, it's good for them to come once a week and get their nutrients in. It's not ideal, but it's a good way. And there are many people that want to come and sit in a lounge, open up their laptop or their iPad, order their cappuccino, order their smoothie, the berry C immune or the anti-stress vibrance or the green detox alkalinizer, whatever it might be, the stress defense shield, and just be in the environment, hear the birds, and chill and relax for an hour. So there's definitely people that want to do that. And then, of course, we've got the chronic disease clinic on the other side, and our new Life Force Cafe, which has got the whole foods. So yes, we're onto something really good here. So it's all about infusion, right? Whether it's an infusion from the drip, an infusion from the Life Force Cafe, whatever we're doing, we're bringing in loads of nutrients, all right, with the oxygen basically being the #1 nutrient because it's feeding, but it's detoxifying. It's a massive free radical scavenger. So that one there is finished. And what I'd like to do now is just bring in what I wanted to show you, what I wanted to share with you today. And bring in this new one, because I'm starting on a Saturday afternoon Life Force Health Maximization Conversations, where we sit in the garden, we sit in one of the lounges, we enjoy each other's company. There's often tastings and sampling of things, talk about the infrared saunas, talk about ozone for that matter, talk about hyperbaric chambers for that matter, talk about oxygen water, talk about oxygen drops, talk about oxygen capsules, talk about nutrients, talk about quantum, talk about acupuncture and reflexology, all the latest, greatest, what's going on, what's happening whereby there's two-way conversations and everybody's learning, and it's lots of food for thought, lots of nourishment, and being with people that you want to be with. So I'm looking forward to these, and the first one will be the Saturday the 30th. Oh, there we go. I see it straight away. And it's coinciding with the opening, the official opening of the 365 Healthy by Choice Intravenous Oxygen Lounge and Intravenous Oxygen Drip Chronic Disease Clinic and our Life Force Cafe. So very, very, very lovely. I'm just pulling the slides through. That's not this Saturday, but the following Saturday, Saturday the 30th of October from 2 until 4 o'clock in the afternoon. And you're all invited. It's complimentary. And bring your family. I've even got jungle gyms and things for children. I'll tell you what will be a bit of an issue is the pool and the pond. So those with babies and things, we would have to be very, very, very careful. Lots of forest walks, lots of indigenous birds to spot. The one architect was here once and he spotted 20 just sitting looking, different ones. I see we've got baby paradise flycatchers right now, and that blue and the brown is just too exquisite. So lots to do, lots to walk. I have people come who just spend an hour walking along the grass with bare feet, their shoulders and their arms in the sunshine, soaking it up, getting water, getting a tea infusion, getting a smoothie, and just letting the world feed them, the earth, the sun, the water, the oxygen, the food. So very, very nice for everybody to come and have a look. Oi, let me just see what I pulled through here, because this might not be the, nope, this isn't the right one. Or is it? No, not the right one. Sorry. I'm going to have to cancel it and just pull through another one. That's funny. Let me see here what it's not that one. So the one I called through, seems another one came through. I don't know. Let me just try again. And if anyone's got any great ideas or things you want to add to what I'm suggesting, let me know, please. And, you know, some people might also feel like, you might feel, oh, there we go. You might feel like also bringing some friends along or bringing some medical colleagues along. Because I just think the more we can expose the medical profession, the health profession to, you know, what the sisters say to me, they never knew there was any other form or any other way, and they are astounded by the results we're getting. So we should really look at, I think, exposing in a very gentle way, you know, medical doctors, health practitioners to what we're doing. I really feel quite strongly about that, because it is a solution, you know, and more people can get well quicker. But having said all of that, there's a lot of doctors amongst all of you, by the way. You've Googled, you've researched, you know what you're talking about, you know your bodies. And, you know, all credit to you. And, you know, it's an honor for me to be interacting with you on this high level. And it's an honor for me also to be questioned by you, and to take things to the next level. And I also love it that you don't just accept, and lots of questions get asked, so that we can, you know, expand, I can educate, and you can then take the information, the knowledge, process it yourself. Because at the end of the day, it's a physician heal thyself. You are your own doctor. So never, ever give that power away, and always use it, because you have it. Your inner wisdom, the answers are all inside. So some people go for consultations, and they go and see numbers of people only to be told what they already know. I know there's sort of some sort of comfort, but really, you know, just do what you need to do. So here's for this evening. And I'm going to be talking about the three main things, and you're going to see some lovely pictures, and we're going to have a lot of fun. And as I said, you're all invited to. No, it started. I don't know where it started. It didn't start at the beginning. How did that happen? Let me just get to the beginning. And I must say, these new cameras take unbelievable pictures. All right, so we're going to be talking, and I have been talking about the Saturday afternoon health conversations and celebrating the opening of the new Life Force intravenous drip oxygen lounge, which is for the quicker, shorter drips, and then the clinic, which is for the chronic diseases and infections. And then we've got our Life Force Cafe. All right. So this is the intravenous oxygen and nutrient lounge. All right. If you look carefully, you will see the drip stands. And the drip stands are there and there. All right. And so they're ready for people to come in. The plants kind of give people some a little bit of more privacy, protection if they want to. Whichever way you look outside, you will see beautiful greenery, and really restful for the eyes and great for the body to actually absorb the electrons, the life force from the plants. So very, very, very nice place to sit and relax. And as I said, this is where the iPads come out and the computers, and the coffee gets ordered from the cafe, and smoothies, light salads. Here's another picture and just another view. So there's just light and greenery wherever you look. So it's really, really, really lovely place to sit. And something special and magic about this room as well, you'll feel when you go there. And then here we have our Life Force Cafe, which is focusing on whole food. And the whole food is coming from the sun, the earth, the garden, the birds, if you like, the smoothies, the tea infusions, salads, and you can sit inside or relax outside. Here's another view, and all very open cafe tables on the outside, overlooking the garden and the forest walks. I'll just go back here. In amongst the thicket there are long winding forest walks, all in nature, and the air is beautiful. And then here's the cafe lounge table area. I'll show you some of the foods that we do serve there from time to time and can serve there. And we will be having also, there's the coffee bar, cappuccinos and things, and tea infusions, smoothies. So people can really, really, really nourish themselves. And that's what it's about, really. It's about taking a little bit of time out for you. And no one's going to bother you. And you can just go within if you want to, walk around, as I said, come back, have an infrared sauna if you like, have an acupuncture if you like, or a health scan. And by the way, all the drips come with a complimentary health scan and a recommendation from us. You don't have to do it or take it or anything, but every drip will come with that. We run it, and everybody, look, it's part of our initial setup, and it's part of what we need to do anyway, but that's complimentary. So that's really nice. And yeah, so we just want people to come and indulge themselves, sit on the deck and enjoy themselves, and have the best fun, because we need to bring lots of fun into our lives right now. And here is our intravenous oxygen drip clinic for chronic disease and infection. And this is where loads of magic happens. So in the drip lounge is where we would do a short oxygen, 20, 30, 45 minute oxygen 2 or 3 times a week. We would do glutathione, we would do ascorbic acid, as I said, the energy boosters, the immune boosters. Here we do the 3 to 5 hour sessions, and we've got 2 rooms at the moment, 4 beds. That's the bathroom, and over here we have the 2 infrared saunas. So the acupuncture happens in those rooms too. So this is just to give you an idea of the actual clinic, beautifully surrounded by nature and trees and tree canopies, and really, really wonderful space here. Lovely energy. And then here would be one of our rooms, and I think you saw this picture already. And this is where the magic happens. So this is where people will come in, and we will take down the specifications and see what the ailments are and the history, and do all the pre-tests, and then then it's over to, I don't know what it's over to. It's over to the oxygen, the universe, and the person. We just the instruments. We just help. We just make sure that the blood's full of oxygen, and the blood clots are dissolving, and that the parasites are going, and that the oxygen is getting to each and every cell and getting inside each and every cell. And then the body forms energy, and then we see the charge rise at the body electrical charge. So that will measure directly and validate that with the quantum SCIO QUEX-ED devices. So we monitoring and measuring everything using that device, the microscope, our smaller Q450s. You know, what you measure, you can manage. And not only that, we are in the age of, objectivity. People want to know, how much have I improved by? They don't want to walk out and believe that they've shifted. So it's evidence-based medicine in the sense in that the research has been done, the patient's feedback, and we can also then validate it with our devices. Beautiful. Let me see what's next. Okay, so what's next to talk about is an ad you're probably going to see on Facebook, or you've haven't seen it yet on the WhatsApp group, but you will. And here we have information on our Saturday event, the first one in the series. And I've said at the bottom here, bring your health questions and join in the conversations, because this is about conversations now. The world is moving in that way. It's not about a talk or a speech, or we need to talk. People need to talk. And I've always encouraged that in my talks as well, is ask questions. Ask me questions, because then I know where you're at and what you want to speak about and what answers you're looking for. So, with that, you are all absolutely welcome to come and join us. And please bring your friends. There's a registration page. So you would then register. So if you go on the website directly, you can register. Look, if we get too many people, then I'm going to have to limit it, obviously. So it would probably be a good idea to register. And then throughout the week, we'll be promoting the event around and on mailings and that. So don't be shocked if you get quite a lot of postings and WhatsApps and things right now. And then we'll have created the momentum for more and more and more of the Saturday afternoon events. So that's what I wanted to share with you today. And we just got to keep on breathing and keep on moving forward. I wanted to just see if Dr. Reddy's still there, if he wants to share anything with us. He might not be directly there. I know his light is still on. Let me give him a call quickly. Just see if he wants to share anything, because he sees the what's going on in the mouth. Nope, he's not around. Anyway, I tell you what we can do is we can have Dr. Reddy next week come and join me, and we can thrash out a bit more on the health side. So thank you very much for being here this evening. I've loved being here. It's an honor always to have you with me too. And let's keep moving forward and surprising the world, and send those chronic disease people to us now. We really have a solution. People don't have to go directly to hospital. We can feed those veins straight away. Come and sit, come and have a coffee, come and enjoy ourselves. Oh, he says he's in a lecture, Dr. Reddy. So we'll get on to him next time. Okay, so let's do that. Let's keep the swell, the groundswell. Let's keep the momentum and keep purifying ourselves. Most important. Okay, I look forward to hearing from you.